Thank you very much, Didier. I appreciate that. I came to this project really wondering about whether pediatric healthcare teams actually think about children's rights and enact them when they're working in a clinical setting. And I kind of knew the answer because I myself have worked in 3 different children's hospitals as a child life specialist, and we would often try to advocate for children's rights when they're hospitalized. And I rarely heard pediatric healthcare professionals actually even mention the word rights. And so we put together a team, and it was a great team because we had nursing involved as well at my institution. And we also had people from early childhood studies as well as myself leading. And we did get a grant from the Canadian government to be able to do this research. And so the background is we know that children generally receive insufficient information regarding their health when they're hospitalized. If you go into an adult hospital and you walk into a room and you ask a patient, "Do you know why you're here?" Now, most adults, you would hope, are going to know why they're in the hospital. Children do not. You will often go into a room and ask a child about why they're here, and they will not know. And their capacities are often undermined, right? So we always take this very strong developmental stance, which basically sets us up at the outset to undermine what they might be capable of knowing or understanding. And so this notion of childism, which is discriminatory in the sense that we believe in some ways that adults are superior to children, and the notion of developmentalism, oh, that child is not old enough, they're not cognitively capable, we can't really explain things to them. Those are the things that shape their experiences when they're hospitalized. And of course, we know with children's rights that we should be doing more listening. We should be doing more information sharing. And it really is within our moral obligation to recognize childhood and to promote children's health-related rights. And sometimes it doesn't happen. What we do see, though, interestingly enough, is a slow-moving, big Titanic ship that's family-centered care, but it's now starting to change a little bit, where people are thinking more about patient-centered care, which is the child, right? So these are some good movements, but we still need more child rights-focused language in the policies, for sure, because that's still very much lacking. So decision-making capacities of children tend to depend quite highly on the attitudes of healthcare professionals, rather than looking first at whether the child is able to understand something that we can help them understand. So there's still an issue with some healthcare providers where they just defer to parents immediately, don't look at the child, and in time, we're hoping that this will get better. But this is a really important piece because healthcare teams are responsible for figuring out an approach that best supports the child participation rights in that setting. And so what you find in the literature as well is that there's huge variability. There are some teams that do an amazing job with children. They are coordinated, they pull the child in as a team member, they participate in shared decision-making, and then there are other teams that just don't do that. Sometimes that's variable in terms of the type of specialty area that you might be working in. It might be different in an outpatient clinic versus an inpatient scenario. So the questions that we asked was we wanted to understand to what extent children's participation rights, as identified in the UNCRC, informs the work of a pediatric team. And do these teams provide opportunities for children to enact their participation rights? And then what frameworks or philosophies, such as family-centered care or child-centered care, inform their practice? And so the first stage was what we did in terms of a systematic review of the literature. And we also evaluated each of the articles that we included in our critical review. So critical reviews are systematic reviews, but they're reviews that target controversies, gaps, limitations in our knowledge. And I felt that that was probably the best method for this particular work. And so we have our inclusion criteria and our exclusion criteria. We ended up with 25 studies that we could look at in terms of the degree to which teams actually engage in children's rights. So the findings, just limited language. These studies very rarely talked about children's rights, right? And we also, from these studies, learned that there wasn't a huge amount of information around the approaches that these healthcare teams used or the composition. And we know that the composition is going to be different depending on the area of expertise, obviously, but also minimal information. Before I get to that one, children know what they want from their healthcare providers. That was another piece that came up in the literature very strongly. And you'll see that in a variety of studies, like what's a good nurse, what's a bad nurse, what kinds of nurses do I like? And it's usually very much associated with warmth, taking the time to talk, taking the time to explain something to a child if they're coming into the room. So children know exactly what it is they want from their healthcare providers, which should be able to inform us as well in terms of what we do. The other thing that was missing from the literature was a notion of what kinds of theories or philosophical underpinnings actually guide the practice. So that was another thing that we had to dig deep to find, right? So I'm moving quite quickly because there isn't a lot of time. So I'm going to the second phase of the study. And what we ended up doing was, so we looked at the literature first, and then we went on and actually spoke directly with the pediatric healthcare providers. So we spoke to a number, so we recruited, so we had 22 individual interviews, then we did some online surveys. All of this is not completely, totally analyzed, so I'm just sharing some preliminary findings with you. The individual interviews we did were with pediatricians, social work, pharmacists, child life specialists, nurses, obviously. So we had a nice range, and the discussions were so rich. We learned so much from how they perceived children's rights, how committed they were to doing the right thing for the children. And so some of the preliminary findings in terms of child participation, many of the healthcare providers talked about the importance of context, right? What was the child's condition like? How much time do we have? Time is usually an excuse, in my view. It doesn't take a huge amount of time to explain something to a child quickly, to hold their hand, to ask them how they're doing. That's really just, it could be a 5 minutes, but that's one of the things that healthcare providers often say, oh, I wish I had more time. I would spend more time with that child, but I don't have the time, right? So we should question that, I think, critically. Also developmentally informed. Well, we don't have a lot of time to spend with the young child because the young child doesn't really understand. And so again, that notion of childism, the notion of developmentalism is so embedded in pediatrics that I would like to tear it out if I could, but I don't know if I can because I don't think that people would actually listen. But it's so important not to just look at the child's development cognitively, but to think about, how can I explain something like this to a 2-year-old? How do I do that? How do I give them an opportunity to tell me what they're thinking or what they're feeling? The philosophy of care, there was a real mix among the healthcare providers. You could just see the transitioning because they'll say stuff like, well, we do child and family-centered care. And so, oh, is it more family or is it more child? Is it a mix? It seemed as though there was more of a mix of philosophy. So you can see that things are sort of moving in a transitional way from thinking about the family always. And of course, you cannot separate the child from the family. I'm not suggesting that at all. But we often don't look at the child and figure out what it is that that particular child might want from us or need from us, right? The language of rights, I think this to me was probably the most upsetting, is that it's basically absent. Now, I know we're only looking at a Canadian sample. I suspect it's similar in the US. I think it's better in Europe than it is in North America. I think North Americans tend to rely on bioethics as a way of understanding how to approach care with children, but children's rights is just not talked about. And yet, they are the patient. What happens to patient rights if we don't talk about children's rights? What does that mean? And then some practices are also interpreted as advocacy. So people would say, well, we try to do what's in the best interest of the child, or we try to listen to the voices of children. So it's all kind of veiled under these terms. They're not actually using the language. And some may say, well, who cares? Maybe that's not a problem. Maybe it's okay. And then looking at team functioning, so much diversity within teams in the way in which they function. And anyone who's worked in a hospital knows that. But many of the healthcare providers talked about the fact that they wanted to have more training. They wanted to understand children's rights better so that they could feel as though they could advocate better, right? Which makes sense. But that training doesn't normally happen, right? Where do they get that knowledge? So the implications, examine and evaluate models of child participation in your setting. Make it real. Bring children's rights to life, right? And then who's on the team? Very few people talked about children being on the team, right? They would talk about parents being part of the team, but very rarely, it's only when we ask that they'd say, oh, yes, her children are on there. But then when you actually ask them about what they do with the children, it's very limited in some cases, right? So again, the training and the education is what's needed to address children's rights. And also you need to have organizational support, right? You may be in an institution that is still very, very much only family-centered and not always taking account of where the child might be in all of this. So I know I'm moving quickly because we only have a few minutes. Okay, this quote I kind of like, and it's very recent. It's from 2023. So healthcare professionals require some knowledge of children's rights if they are to create conditions in which children can take an active role, which kind of sounds obvious, right? And yet people are still asking for more information because they don't have it, right? And we shouldn't be still in that sort of situation when we know that the UNCRC has been around for many, many years, right? So I'm going to leave you with a couple of thoughts, questions. So does it matter that there's limited knowledge and discourse surrounding children's rights in training, education, as well as in practice? Does it matter? Is it important that the care is good? Or do we need the language of rights alive and well and functioning on the ground? I don't know. I can just throw it out if somebody just wants to answer that or attempt to comment on it. Michael, you look like you're going to say something. Sure, go ahead.
How would you move this agenda forward unless you had such discourse?
Right, exactly. And people have to buy into it, right? So one of the distressing parts was that when I asked why there wasn't more language of rights being used in the clinical setting, the answer is it's controversial. We don't like to bring up rights. We don't want to go there. It makes parents upset. We don't want to challenge the parent. So there's actually a stigma that's attached to it. And then I also had some pediatricians say to me, well, Donna, children's rights are human rights. So why do we need to talk about children's rights if we already have human rights? And aren't children humans? Which, yes, makes sense. But we also know that children need their own rights too, because of who they are and some of the vulnerabilities that accompany childhood. Right? So it's the same, but it's also different. Any other thoughts about that, whether it matters? Am I worrying about something that is not necessary to worry about? Yes. Artemis?
For making us think about this. It's very important that we think about children's rights because, as you said, maybe their environment is hostile and you need to point it out. So you're a child advocate at the moment. So we really have to be very focused on their rights, and maybe it will be their only chance to survive in a way mentally.
Exactly. Right. So existential, the way you just phrased that. Anyone else? Yes, Barbara?
Yes, in my practice, I use this a lot, the child rights, especially with young adolescents or even children, like 7, 8 years old, in the setting where the parents are divorced or separated, and there's rivalry between the parents, or the child doesn't want to go with either parent or with the father because he doesn't feel comfortable because there's a new family there, or whatever issue, or they just even suffer violence in that setting. There's like maybe gender violence and
Right.
the domestic violence, and then so the child doesn't want to go and visit the father or the mother. It can be either. I've seen both. And so I tell the child, listen, you have a right to be heard, and you have a right, and you have the right to have your opinions taken into consideration in the matters of your health. So, and when they listen to that, they really like it. And one patient, he was 12 years old, and he also had like Asperger's syndrome. And so the next visit, he came with he had learned all the convention.
Oh, wow.
And was even, telling all the rights he had, and he showed it to his father also, so.
That's amazing, Barbara, but I think that happens really rarely. Yeah.
So I use it a lot when there's violence involved.
Okay, interesting.
And I even put it in my notes. I said the child has a right to be, to be heard, and because there's when these things go into court, the separations and so forth, and the visits and all that, it's really difficult for children because it's a battle between the parents, and I use that a lot, and I even put it in my notes.
Wonderful. Thank you. Jeff?
Well, it's not a rhetorical question. Obviously, it's critically important. One of the things that the Europeans have, so the European, I can't remember exactly the name of the network of children's hospitals. They have a charter or whatever that's available in hospitals. That's a child rights-based charter of what rights children have when they come into the hospital. So one really concrete thing that we could do is we could take that and try to begin to disseminate it through hospitals, children's hospitals in particular in North America, in particular in the US. The issue that you said about controversy now is controversy on steroids. In the United States, there's this movement of parental rights, particular Florida is the epicenter. And so any opportunity that we have to get to really in a very assertive, aggressive way, move the agenda of children's rights forward, it's important. And we've lost significant ground in many places, but in particular the United States. So a children's charter, child rights charter that was in every hospital that identified the rights of that child, I think would be a tremendous initiative for us.
Right. Yeah, that would be amazing for sure. And you even see these places in hospitals where they have patient offices, where you should be able to go and make a complaint. Well, you never see children walking in there. It's parents, right? So sometimes there's a lot of sort of rhetoric around this, but there's not a lot of reality sometimes, I think. And so if we don't have the language, then I think in some ways we've lost.
Just a quick comment.
Yeah.
You mentioned bioethics. About 5 or 6 years ago, we had a small conference and where we invited the key bioethicists from around the United States. I mean, these were the key leaders in bioethics from the United States, and one bioethicist from Hospital for Sick Children. We then had 4 or 5 child rights advocates from around the world.
Oh, I remember you telling me this. Yeah.
Came to this meeting. And then we had several that were online. Within 2 hours, it was supposed to be a 2-day meeting. Within 2 hours, the American bioethicists said that there's no relationship between bioethics and children's rights. They completely ignored and discounted the role of children's rights in pediatric bioethics. The one person that was dissenting was the bioethicist from Sick Children.
Right.
We published
Randy Zlotnick-Shaw. Right. Yeah.
We published the findings from this meeting, but at least in North America, at least in the United States, the concept of rights is not even embraced by bioethicists, pediatric bioethicists.
Right.
So we've got a long way to go.
Yes. Thank you, Jeff. And so just the final question then, does anyone else have any other thoughts? Michael? Right. Just getting your microphone there.
So my name is Michael. I'm a pediatrician from the United States. Jeff just mentioned bioethics. I do a lot of research. So do children's rights issues, as you think of them and the need to promote them, do they have a role in terms of IRB and informed consent with children, and assent versus consent, which is the current cutting point? This is new to me, the work that you're doing. And I'm just wondering, have we ignored it in research? Is it unfair to ask this of you at this point?
So you're asking about children consenting for research.
Right.
Right, or assenting for research. Yeah, so that still happens, but it's very rare to have a study with children where parents don't consent, right? Particularly in hospitals. So even though in Ontario, for example, in Canada, there is no age of consent, but of course you couldn't walk into a hospital room with a preschooler and start studying and talk to them about it without making sure that the parents were aware. So there's still, which for reason, I mean, I'm not being unreasonable about that because it's important that parents are aware and supportive. But there's still this lacking of explicit advocacy of children's rights, and afraid or fear of using that word that somehow things are going to turn against you as a healthcare professional. I still think that's there. And how do we do more? How do we get past these controversial fears? How do we advocate for children by letting people know that they have a right to participate? It doesn't mean that you automatically take what that child says, but you consider it, you listen, you hear them out, you allow them to express how they feel. And if you can't, then maybe they don't want to have a needle. You know, I wish you didn't have to have a needle. I really wish that this wasn't something you needed. But you've at least then given them the opportunity to be heard, right? So it can be simple little things that can make a huge difference in our respect for the child. Yes.
Thank you. As a pediatrician, I believe that the respect of their human rights starts from the first beginning that they come to our office. We have to ask them if they want us to check them. We have to explain, not even the parents, we have to explain why they have to do the vaccination or why they have to take the medicine. I believe everything starts from this little beginning.
Yeah, and it sounds like a little beginning, but it's big, right?
It's
Yeah,
big.
it's very big. Yeah.
Thank you. I wanted maybe to add something because we just began a new consultation for children who are victim and exposed to intimate partner violence with their parents. And we didn't know if it was a good idea to see them because it's so much power for the parents to prepare the children and to say, you don't have to say that, or remember not to speak about that. But we began that, and maybe if we don't evaluate well the children, we could sensibilize the children and the parents about their rights, and that's our first step. But it's difficult to know if it's worse or not to see the child when there is domestic violence. But maybe the first step should be in the school, because I see a lot of patients that are suffering because the teacher doesn't respect them, the children, and maybe there is a lot to do in the school too, just to inform children that they can have an opinion, and maybe they could evaluate the professor or give a feedback, anonymous feedback to professor when they are not acting well and respecting the child. I think it could be a first step that we don't have any, for the moment, any proposal in school about that.
Right. Yes. Very good suggestion. That makes a lot of sense. And the education system doesn't always do well either, right, with children's rights. So it's not just healthcare. Does anybody else have any questions or comments?
Perhaps,
Have to end, sure, no problem. Thank you so much for your participation and your good comments. Thank you.